A group of healthcare professionals are saying that there should be mandates for all who work in the healthcare system because of what they say is an ethical need to do so, to be vaccinated. We see that there are local communities that are bringing mask mandates or recommendations. And so are we at a point where Americans should be looking to professional organizations, businesses, and local officials for guidance on what to do more than the federal government at this point?
Well, first I would say we would hope that the guidance is aligned with. There are going to be localities that have higher rates of outbreaks that they may make additional recommendations. They may take steps to keep their communities safe. We certainly have seen, as you noted, that there are institutions, including across the health industry, as many of you may have seen today, 57 leading healthcare groups, including the American Medical Association, the American College of Physicians, the American Academy of Pediatrics, and the American Public Health Association, all called for all healthcare and long-term care employees to mandate employees be vaccinated against COVID. Now, that is the healthcare industry where they are very much on the front lines, and these actions, in our view, are meant to keep patients and employees safe. And in fact, I expect our own federal healthcare providers may look at similar requirements as they do with other vaccines. As it relates to what the American people should look to, look, the CDC is looking at data across the country. They provide broad public health guidance, not based on politics, driven by science and data, and they make updates when they feel it is necessary to make updates, and then localities will apply that.
Are you suggesting perhaps the VA would be making a similar recommendation or requirement? Is that what you're hinting at there?
Well, I think there'll be more to say in the coming days on that, Kelly. But I will tell you that we certainly believe that health officials are on the front lines of being vulnerable to getting COVID, and we certainly support these actions by these hospital associations.
Does the White House view it as a benefit if employers as varied as the NFL to hospitals are trying to push vaccination? Would that close the gap, in your view, with some of those who have not yet done so for a variety of reasons? I mean, do you see this as another lever that might actually be helpful to the president's goals?
It may. And beyond the president's goals, it may save lives, and that's the most important factor in our view. And so we're seeing institutions, healthcare providers, colleges and universities, the NFL implement different approaches and steps to incentivize and increase vaccination rates. The more people are vaccinated, the more the country will be safe.
One last one. Do you expect that for air travelers domestically in the United States who've been required to wear masks by FAA regulation for a long time, that's set to expire in September, should we anticipate that that would likely stay in place given the Delta variant?
I don't want to get ahead of any guidance by our CDC, but certainly they will continue to provide guidance on masks that keeps more people safe. Go ahead.
Thanks, Jen.